sputum, you may experience a cough that lasts for over 3 weeks and pain when coughing or with normal breathing. Other symptoms include unexpected fatigue, fever, night sweats, loss of appetite, and weight loss. If a patient admits having active tuberculosis or you suspect that they might be infectious, they should be referred to a local admitting facility that is equipped to deal with TB. Treatment should be deferred until the patient is no longer infectious. Some larger facilities, pulmonary infectious disease specialists, and any other specialties that admit and treat patients with TB obviously have a higher risk of exposure. These facilities would be obligated to provide routine testing, specialized personal protective equipment, and fit testing on a routine basis. If you have questions about TB, site-specific policies, or testing, talk to your safety and health officer. In 2012, OSHA began to revise the Hazard Communication Standard to be consistent with the United Nations Globally Harmonized System of Classification and Labeling of Chemicals. The Globally Harmonized System, or GHS, is an international approach to hazard communications that provides specific criteria for the classification of chemical hazards and a standardized approach to label elements and safety data sheets. Since the United States is both a major importer and exporter of chemicals, it was common to see labels and safety data sheets required by other countries. Even the defining properties like the exposure limits or flash points of a chemical weren't consistent. A product might be considered flammable or toxic in the United States, but not in the country it was imported to or exported from. OSHA defines a hazardous chemical as any element, chemical compound, or mixture that is a physical or health hazard. OSHA's Hazard Communication Standard requires your employer to train you to recognize chemical hazards using the information provided on product labels and in safety data sheets to take the necessary precautions to protect yourself. This plan shows how hazard communication compliance is actually achieved in your facility. It's located behind the green tab in your red OSHA Guard manual. It lists the hazardous chemicals in your facility and describes how your employer will use safety data sheets, labeling, and training to inform you about chemical hazards and precautions to stay safe. You're required to have safety data sheets for every hazardous product that you have in your facility. SDSs, formerly known as Material Safety Data Sheets or MSDSs, identify the hazardous properties of chemicals that may pose a health or physical hazard, and they provide you with guidance for appropriate protective measures. SDSs are available to you anytime during business hours and are usually kept in a binder with your OSHA manual or on a computer. Either way, you must be able to obtain the information immediately, especially in an emergency. If you keep them electronically, they must be available offline and not contingent on internet access. If you order a new product, it's important to request the safety data sheet and add it to your hazardous chemical master list. The master list is like a table of contents that lists all the products in your binder or file folder. So why reference a safety data sheet? If you work with a product and there's an exposure or a spill, or maybe something makes you feel nauseous every time you use it, that's why these sheets are here. If you have any questions or concerns about the products you work with, access them anytime during business hours. Although SDSs might look different from manufacturer to manufacturer, they contain the same information in a uniform 16-field format. In addition to safety data sheets, you have the obligation to make sure chemicals are properly identified. Although the system for labeling has changed, the fundamentals haven't. If a product is in its original packaging, it's up to the manufacturer to identify it and convey the hazards. If you remove or transfer that product to a different container, then you have the responsibility to identify the contents and the hazards according to the revised standard. Labels now have 6 standardized elements: product identifier, pictogram, signal word, hazard statements, precautionary statements, and manufacturer information. For what it's worth, all 6 elements can be found in the first 2 sections of any safety data sheet. Because the Hazard Communication Standard requires a decent amount of information, it's okay to utilize backsplashes and placards if necessary. Just make sure the labeling is clearly associated with the product. This hazard rating chart, or one like it, should be posted somewhere in your facility. It explains the rating system used under the Hazard Communication Standard aligned with GHS. It also gives a visual reference for safety data sheets in label format. Pictograms are an important component of your hazard communication program. They're a visual representation of the chemical hazard classification, and they're used on safety data sheets and product labels. The 9 pictograms used to convey hazards under the Hazard Communication Standard are flame, exclamation mark, skull and crossbones, health hazard, corrosion, flame over circle, gas cylinder, exploding bomb, environment. These pictograms represent a physical, health, or environmental hazard. OSHA doesn't enforce the use of the environmental pictogram since that doesn't impact employee safety, but it shouldn't be overlooked since federal, state, and local authorities might require specialized disposal. So for a quick summary, Have safety data sheets available for all the products that you could be exposed to. Label any product you remove from its original container or transfer from its original packaging. And most importantly, talk to your safety and health officer if you have questions about your hazard communication policy. Regulated medical waste, commonly referred to as biohazardous, infectious, or medical waste, is in simple terms any waste that may be contaminated by blood, body fluids, or other potentially infectious materials. The Bloodborne Pathogen Standard uses the term regulated waste to refer to the following categories of waste. Keep in mind, OSHA's function is regulating employee safety, so their standards center around handling medical waste safely. The disposal of medical waste is done in accordance with applicable state regulations. These rules are typically published by your state's Environmental Protection Agency or Department of Health. For the most part, medical waste generated in your facility will fall into two different categories. Sharps waste includes items like needles, lancets, scalpels, exposed ends of dental wires, staples, and broken glass, pretty much anything contaminated with blood or other potentially infectious materials that can puncture or lacerate your skin. Red bag waste are soft waste items saturated or visibly contaminated with blood or other potentially infectious materials. This would include items like bandages, gauzes, plastic tubing, cotton rolls, and visibly contaminated personal protective equipment. All other wastes, like most gloves, table paper, patient bibs, and gauze that's not bloody or saturated isn't regulated and can usually be disposed of with regular trash. Keep in mind the term saturated is subjective. If there's any doubt, err on the side of caution. Regardless of its category, medical waste should be segregated and disposed of as close as feasible to the area where this waste was generated. This is referred to as point of origin disposal. Sharps should be placed immediately into a puncture-resistant, leak-proof container. Make sure the lid is securely fastened and the opening and the biohazard label and fill line are clearly visible and orientated in the same direction. If they're wall-mounted, make sure they're at a comfortable height for everyone that has to use them. Pay attention to the fill line. When sharps reach this line, the container must be sealed and disposed of according to your state's regulations. Soft waste is disposed of into red bags. These bags are identified with the biohazard symbol and designed to be resistant to punctures, tears, and leaks. Just like sharps containers, they should be located as close as possible to where you're actually generating waste. Red bags should also be replaced more often than sharps containers. Absorbent materials saturated with blood and other potentially infectious materials are much likely to smell and be unsanitary. Tie or seal these bags at the point of origin and bring them back to your final destination storage area. It's important to be familiar with the disposal requirements in your state. States often require a licensed transporter and require scheduled pickups. Other states actually let you treat and dispose of your own waste using Isolizer or other approved methods. Regardless, it's important to keep transporter receipts or logs documenting the safe treatment and disposal of these regulated wastes. You can do an internet search for medical waste regulations in my state or visit your state's portal here. Although a spill of blood or other potentially infectious materials is unlikely, you have a contingency plan for spills. If you have a red OSHA manual, it's located behind the orange medical waste tab on page 6 of your plan. Depending on your size and specialty, you might have a spill kit to clean up bloodborne pathogens. If you do, be familiar with its location. You can also assemble your own kit or use supplies that are readily available. Most facilities will have the recommended materials on hand. The recommended components for a kit to respond to a small blood spill include gloves, eye protection, red bag, hospital-grade disinfectant, absorbent materials like paper towels or kitty litter. Even an extra sharps container and a broom and dustpan are usually available in most facilities. Like any exposure risk, it's important to select the appropriate personal protective equipment. Although most spills might only require gloves and eye protection, additional PPE is always available. If there's broken glass, it's important to remove it first. Have a sharps container ready and use a broom and dustpan or forceps to safely remove the broken shards. Cover the blood spill with paper towels or another absorbent material to soak up as much blood as possible. Keep in mind that the disinfectant won't work if the blood still covers the surface. Dispose of these absorbent materials into a red bag. Pour a hospital-grade disinfectant over the area and allow it to sit for the recommended contact time. If it's an absorbent surface like carpet, it's advisable to steam clean it if possible. All disposable personal protective equipment and cleaning materials should be disposed of into a red bag, and finally, wash your hands. With that said, this concludes my role in your OSHA training. If you have questions about your policies, talk to your safety and health officer or reference your OSHA Guard manual. Thanks for watching.